Hello everyone, this is Dr. Rashmi. Oral cavity has very important role to play in proper digestion, in communication, and to taste the food, whichever we are fond of. So, with respect to digestion, if there is healthy tooth and gum, the digestion starts properly by the mastication process, then it helps the further digestion of food. With communication, what I mean is if somebody has bad breath, it is really awkward. Somebody might lose the confidence also. So, it is important to have a healthy oral cavity. And one more thing is to get the taste of whatever food we eat, oral cavity is very important. So, to maintain oral cavity, Ayurveda has given prior importance. As this day begins, once all the waste are put out, that is by passing urine or the stools, then the first regimen is Danta Dhavana, that is brushing the tooth. In the classics, different types of herbs are mentioned which are having mainly the bitter taste or the astringent taste and sometimes the sour taste. So the drugs which are good for oral cavity are basically having bitter, astringent and sometimes sour taste herbs. These days we use a powder form of these, and we even see in the market some toothpaste are also available which helps to maintain the health of gums as well as the tooth. Other than that, following Danta Dhavana, it is Kavala and Gandusha. These are two important procedures for the maintenance of oral cavity health as well as to treat conditions or diseases of oral cavity as well. Now, what are these two terminologies? Which we are familiar with is oil pulling. So, these are not limited to just oil pulling. Now, Kavala is a method where uh, amount of the medication oil or decoction is taken so much so that the liquid what we put inside the mouth can be moved within the mouth. So basically it helps in flushing and also in gargling whenever there is issue related with the throat, that is tonsillitis or pharyngitis, it helps there as well. And one more is gandusha. Here the amount of oil or decoction is taken so much so that it fills the mouth completely. That means that much of amount of the medicine is taken and it is kept like that till it really starts to hurt the cheek muscles, or when the nasal discharge starts or watering of eyes starts. So till that duration it has to be kept. This is also done as a part of daily regimen. So here with this, it not only helps in improving the circulation and removing the toxins within the oral cavity, it also helps in taking care of sinuses as well. After this, other than that, we also go with Pratimarsha Nasya. Nasya is a Panchakarma procedure where medicine is instilled into the nostril. Now, Pratimarsha Nasya is the same procedure which is done as a daily regimen where smaller dosages of medicine is used. Again, which medication should be used in Pratimarsha Nasya? Your Vaidya or doctor would decide looking at your Prakriti and state of body. So these are few of the important regimen which helps in taking care of our oral cavity to perceive the taste really well and to avoid bad breath if the origin of bad breath is the oral cavity itself. Other than that, there is a treatment procedure called as Pratisarana, that is medicated powder is mixed along with honey and massaged over the gums and the tooth. Has got wonderful results in diseases related with gums and the deeper tissue, that is periodontitis condition also. It has got really good results. Other than that, Ayurveda has also mentioned about scaling techniques with the help of instruments or with sharp leaves without damaging the gums. So, dentistry is also explained in detail in Ayurveda. So, scaling was also explained then by our acharyas. Wherever we see the calculus, the food debris which becomes calcified and remain in the tooth as well as in between the teeth and gum. So to remove that, lekhana karma, that is scaling, is also being mentioned. Other than that, if the swelling is so much in the gums, bloodletting procedures are also told in Ayurveda, which gives really good results in periodontitis and gingivitis conditions. Hence, If you go to your Ayurveda Vaidya, you will get overall understanding how to take care of your oral cavity. If you have issues like hypersensitivity related with gum disorders like gingivitis or periodontitis, repeated aphthous ulcers, or sinusitis, or with sore throat, all these conditions are taken care really well through Ayurveda procedures with local therapies, even along with medications if required. So, if this information is useful about oral cavity, do like and share with your loved ones. If you have any doubts or you want to get to know more about Ayurveda, do put a comment. Thank you so much for watching.